In today's video, we are diving into the world of palliative care, a compassionate approach that enhances the quality of life for patients and their families facing serious illnesses. Whether it's managing pain, providing emotional support, or helping with complex decision making, palliative care offers a holistic support system during challenging times. I'm Dr. Smrita Singh, and I'm an MD and wellness expert. Palliative care is a comprehensive approach aimed at improving the quality of life for patients with serious illnesses and their families. The World Health Organization defines palliative care as a means to improve quality of life through the prevention and relief of suffering using early identification, assessment, and treatment of pain and other physical, psychosocial, and spiritual problems. It's about providing an extra layer of support to patients and their families, helping them live as actively as possible until the end. When facing life-threatening illnesses, the journey can be incredibly challenging, not just for the patients, but also for their loved ones. Illnesses can chip away at a patient's physical and emotional foundations, making it harder to cope with daily life. Palliative care steps in to provide relief from the symptoms and stress of a serious illness, offering a holistic support system that addresses a wide range of needs. Anyone with a life-threatening illness can benefit from palliative care. This includes patients with advanced cancer, that is, cancer that has spread or is no longer responding to treatment. Patients with chronic organ failures, such as kidney failure, heart failure, or liver failure. People with frailty-related illnesses, with conditions like advanced dementia or Parkinson's disease, where frailty significantly impacts the quality of life. Palliative care isn't limited to end-of-life situations. It can be integrated at any stage of the illness, even alongside curative treatments to improve the overall well-being of patients and their families. Palliative care can be provided in a variety of settings, ensuring that patients receive support wherever they are. Many patients prefer to receive care in the comfort of their own homes. In nursing homes, like long-term care facilities can provide palliative care services. Hospices are specialized facilities that focus on end-of-life care. Specialist clinics are clinics which are dedicated to specific illnesses and may have palliative care services. Community hospitals. Now, these are smaller hospitals which often provide palliative care as part of their services. Acute hospitals. Now, these are larger hospitals with comprehensive palliative care teams. A major component of palliative care is the use of medications to manage pain and other symptoms. This includes pain relief using medications like opioids, non-opioid pain relievers, and adjuvant therapies to control pain. Addressing symptoms such as nausea, vomiting, shortness of breath, fatigue, and loss of appetite. The goal is to enhance comfort and improve the quality of life, allowing patients to engage in daily activities and spend meaningful time with their loved ones. Serious illnesses often come with difficult decisions. Palliative care teams help patients and their families navigate these decisions, providing support in complex decision-making processes and advanced care planning. This includes discussions about treatment options. By understanding the benefits and burdens of different treatments, one can make a better decision. The goals of care. These define what quality of life means to the patient and aligning care with their values and preferences. Things like advance directives, which are legal documents that outline a patient's wishes for their care if they become unable to communicate. They also provide psychosocial support. Illnesses don't just impact the body, they affect the mind and emotions as well. Palliative care provides psychosocial support to help patients and their families cope with the emotional and psychological aspects of illness. This includes counseling. Professional counselors and therapists offer support to address fears, anxieties, and emotional distress. Grief and bereavement support, helping families navigate the grieving process before and after a loved one's passing. Next are social work services, which is assisting with practical matters like financial planning, assessing community resources, and coordinating care. It also includes spiritual care. For many patients, spirituality and faith play a significant role in their coping mechanisms. Palliative care teams often include spiritual care providers who offer support tailored to the patient's beliefs and values. This can include chaplaincy services, where providing spiritual guidance and support to patients' families, rituals and practices, where facilitating religious or spiritual rituals which are important to the patient, exploring meaning, helping patients find meaning and purpose in their experiences, even in the face of illness and mortality. A key aspect of palliative care is the multidisciplinary team approach. This means that a diverse group of healthcare professionals collaborates to provide holistic care. The team typically includes doctors, who are physicians specialized in palliative care, oncology, geriatrics, and other relevant fields. Nurses, who are trained in pain management, symptom control, and providing emotional support. Social workers, who are professionals who address practical and emotional needs, helping families navigate the healthcare system. Therapists include physiotherapists, occupational therapists, and speech therapists who work to maintain and improve physical function. Art and music therapists, using creative therapies to enhance emotional well being. Dietitians offer nutritional support to address changes in appetite and dietary needs. Psychologists provide mental health support and counseling. Palliative care is guided by several key principles. First one is the affirmation of life. Palliative care affirms life and regards dying as a normal process. The next is no intention to hasten or postpone death. The goal is neither to hasten nor delay death, but to enhance the quality of life. The next is symptom management. Effective management of symptoms like pain, nausea, vomiting, and delirium. A holistic approach which addresses physical, emotional, social, and spiritual needs. Team approach, utilizing a multidisciplinary team to provide comprehensive care. And the last principle of palliative care is to provide support for families by recognizing the needs of families and providing support through the illness and beyond. Let's look at some real life case scenarios. A patient named Raj who is diagnosed with advanced cancer. He experiences severe pain, fatigue, and emotional distress. A palliative care team steps in to provide relief through medications, counseling to address his fear, and support in making decisions about his treatment options. They also assist Raj's family in coping with his illness, providing emotional support and resources. Let's look at another scenario. An elderly woman, Mrs. Gupta, has chronic heart failure. She struggles with shortness of breath and frequent hospitalizations. Palliative care helps to manage her symptoms, optimizing her medications to improve breathing and reduce hospital visits. The team supports her in setting realistic goals for her care, ensuring her wishes are respected. Mr. Patel has advanced dementia and his family faces the challenge of providing care at home. Palliative care offers guidance on managing his symptoms, supporting the family in making decisions about long-term care and providing respite care to prevent caregiver burnout. Now, despite its benefits, palliative care faces challenges and misconceptions. Many people are unaware of palliative care or misunderstand it as only end of life care. Cultural beliefs and practices can influence perceptions of palliative care, sometimes creating barriers to its acceptance. Access to palliative care varies, with disparities based on location, socioeconomic status, and healthcare infrastructure. There can be challenges in integrating palliative care with other medical treatments, especially when there is a focus on curative treatment. Palliative care is all about making life better for people who are really sick and their families. It's like a big, warm hug that helps them cope with the tough stuff. The goal is to manage pain and other tough symptoms, covering not just the physical but also the emotional and spiritual sides of things. In a nutshell, palliative care is about surrounding patients and their families with a supportive, comforting environment, making sure their remaining time is as comfortable and meaningful as possible. If you enjoyed this video, don't forget to like, subscribe, and ring the bell for more insights. Thanks for watching and see you next time.